Very good morning, all my students. Let us start with the ENT segment. So, the first MCQ, beta, and with the help of these MCQs, I am giving you must-read topics. These are the important points for upcoming FMGE examination. In a patient with hypopharyngal carcinoma, more than 4 centimeter. So, this question is often repeated in your examination. So, what the TNM classification T status of this patient is more than 4 centimeter now. What is T1? If it is only one area of hypopharyngal, greatest dimension should not be more than 2 centimeter. If it is 2 to 4 centimeter, it is T2. And if it is more than 4 centimeter, which I have given in MCQ, it is T3. I'm understandable. What is T4? Is something the tumor is going beyond hypopharynx. So we divide into T4A, T4B. Always remember T4A is the involvement of thyroid cartilage, nearby structure, or hyoid esophagus, thyroid gland. These are T4A. What is T4B? Just remember, like in CA larynx we have read, chest involvement, carotid artery, prevertebral space. Whatever we have learned in CA larynx, we can apply in T4B, status of hypopharynx carcinoma. So again, if it is less than 2 centimeter, it is T1. 2 to 4 is T2. More than 4, this is hypopharynx carcinoma. What is hypopharynx? Is covering your larynx from both sides, which is divided into right pyriform, left pyriform fossa. And I'm expecting one MCQ on the pyriform fossa is the most common site for hypopharynx malignancy. First point, most common site for hypopharynx malignancy. Second point is which nerve is crossing from this area? Internal branch of superior laryngeal nerve. Internal branch of superior laryngeal nerve. So in this MCQ, answer will be B option. Coming to the next one is a level 1 twist in the MCQ. I'm not asking you where is the foreign body. I'm asking you what is the management. So look for AP view. What we have learned, look for AP view. In the AP view, it is circle, it is esophagus, esophagoscopy. So we'll be going for esophagoscopy. Bronchoscopy, if it is in the respiratory tract. Tracheostomy, if severe dyspnea is there in the MCQ. Helminch maneuver, very important. Choking patient, history of patient have some choking sensation during the dinner. The first method, Helminch maneuver, to dislodge the foreign body. Clear? So these are the important points in this MCQ. Answer will be C option. In the last spell beta, just revise the topic in a fast mode, like we are discussing the MCQs with you. AP view, if it is line, it is trachea. If it is circle, it is esophagus. Done? Is it clear? Coming to the next MCQ, patient on an endotracheal tube. Tracheostomy is planned. So which tube is the best tube? Out of PVC tube, polyvinyl chloride, the most important is cuff tube. What is the advantage of this cuff tube? This cuff will keep the tube in position. Like this is my trachea. We are putting the tube. We inflate the cuff. So this cuff will reduce aspiration. So what is the important advantage of this cuff? It reduce aspiration. It keep the tube in position. This is the second advantage. It keep the tube in position. It reduce aspiration. What is the drawback? I'm confident you must be aware. What is the drawback? Pressure necrosis on the trachea. So the only drawback of this tube is pressure necrosis of trachea. Therefore, we always give low pressure, high volume in these patients. Low pressure, high volume in this patient. How frequently we should deflate the cuff? Too early for 5 minutes. Important MCQ for upcoming examination. Metallic tubes, silver Jackson tube. We are rarely using. It is used for home care. It is very easy to clean the metallic tube. So it is used for home care. Am I understandable? Are you getting this point? Uncuffed tube rarely used. Question number, next MCQ, one of the easiest question. What I'm asking you, patient not responding to the initial maneuver. First of all, tell me what is the maneuver. The initial maneuver is Trotter's maneuver. Trotter's method. What is Trotter's method? Pinch the nose, spit out the blood. Patient not responding. We try chemical cautery or we try packing. Patient not responding. What is the next step? Ligation. Which artery? I will ligate artery that is known as artery of epistaxis. Which artery is the artery of epistaxis? Sphenopalatine artery. So your examiner can either ask you artery or they can ask you the full form. What is TELESPA? TELESPA stands for transendoscopic ligation of sphenopalatine artery. Trans-endoscopic ligation of sphenopalatine artery. Trotter's method, epistaxis. Trotter's triad, nasopharyngeal carcinoma. Again, I'm taking one PYQ, 40-year-old female ENT OPD. Make a habit of reading the last line of the MCQ in a fast go. It helps a lot. Sometimes you get the clue answer in the last line. Merciful anosmia. Merciful anosmia is a keyword for atrophic rhinitis. And when every corner is atrophied, your roomy cavity is there. So answer will be C option. Merciful anosmia. If examiner mention the word woody nose, it is rhinoscleroma. What is common? In these two, common is foul smelling crust. If merciful anosmia is there, it is atrophic rhinitis. If examiner mention the word woody nose, it is your rhinoscleroma. Now, what keyword he should mention for hypertrophic rhinitis? They will mention the word mulberry-like nasal mucosa. Better listen to my words. Mulberry-like mucosa is equal to hypertrophic rhinitis. Pearly white mass is equal to polyp. Unilateral foul-smelling discharge from the nose is equal to foreign body. So these concepts should be on your tips. This keyword will help you in the examination hall. Then coming to the next one, again, in every examination, they ask you one question on referred otalgia. 10-year-old child, throat pain, ear, he is diagnosed with recurrent tonsillitis. Patient is having otalgia. You tell me, oropharynx, tonsil, bed of the tonsil, styloid process, all are causing referred otalgia by 9th nerve. But either examiner will ask you about 9th or 10th nerve. Basic simple funda. 9th nerve is your base of tongue, oropharynx and tonsil. What is 10th nerve involvement? Hypopharynx. If there is any pathology in hypopharynx, larynx or esophagus, it is your 10th nerve. So answer will be option A. Next MCQ, again, a old MCQ of your examination. 35-year-old, very important PYQ. 35-year-old female, take a tablet of aspirin for headache. Later she is having wheezing, breathlessness. While talking about if this female is having nasal polyp, we are talking about Samster's tract. And all these symptoms are precipitated due to IgE release beta. Always remember. So answer is A option. Nasal polyps. With patient is having severe dyspnea after taking one medicine. We are talking about one triad, Samster's triad, that is sensitivity to aspirin. It is due to IgE release. Is it clear, beta? Dear students, coming on the next MCQ, a 50-year-old male with tinnitus, vertigo, fluctuating deafness. Let us crack this MCQ in a nice way. First clue given by the examiner, male. What we have learned in our lectures. If MCQ of ear, male is there, Meniere's disease, tinnitus, vertigo, sensory deafness. Examiner is giving you the order of the symptom. First symptom is always tinnitus, followed by vertigo, followed by fluctuating deafness. This keyword, fluctuating deafness, means sometimes the deafness is coming down. Why? Because it depends on the fluid level of the body. Body fluid level come down, deafness comes down. Body fluid level increases, deafness increases. This audiogram, again, the fourth important keyword, rising curve. Graph is rising curve, low frequency hearing loss will be going in the favor of Meniere's disease. Either examiner will give you otosclerosis, like last examination they have highlighted otosclerosis. This year I am expecting MCQ on Meniere's. Rising curve, fluctuating deafness is here Meniere's. Meniere's associated with which gene? They can ask you. Cochlean gene is present on 3 chromosomes, 6, 12 and 14. Important point. This is sensory deafness. What is the keyword for sensory deafness? We have learned in the classroom. It will be recruitment phenomena. This patient will be having recruitment phenomena. This patient will be very uncomfortable in noisy surrounding. Tullius phenomena. Expect one MCQ. What is the treatment of this patient? M for Meniere's, M for medical treatment. So always remember, 80 to 85% of the patient, they respond to medical treatment only. They respond to medical treatment only. Then again expect one MCQ on BPV. What is benign paroxysmal positional vertigo? This is benign, very mild, of few seconds vertigo in a position. No hearing loss, beta. Everyone, every student listening to me, just remember this point. BPV, there is no hearing loss. Posterior canal is commonly involved. Investigation of choice is Hall-Pick maneuver. Treatment is Aplace maneuver. So if I want to revise BPV topic, which are the four important points? Very mild vertigo of few seconds, no hearing loss, posterior canal is commonly involved, investigation of choice, Hall-Pick maneuver, treatment of choice is Aplace maneuver. These are the important points, but I will advise you not to write these things at this last spell. Just revise with me in the discussion only. Vestibular neuritis, this is a second diagnosis where there is no hearing loss. Patient have vestibular symptoms only. Which two conditions of ear have no hearing loss? BPV, one is vestibular neuritis. Done. Coming to the next one, nasopharyngeal angiofibroma, young boy. What is the next line of management? What is the important concept? We have learned in the class. No biopsy, no debulking. It means biopsy option rule out. These options rule out. One is chemoradiation, one is CT. Examiner is asking you next line. So the patient is coming to you. First, I will be doing CT examination, on which I will appreciate which sign? Hallman-Miller sign, posterior wall bending down. Hallman-Miller sign, posterior wall bending down of maxillary sinus. What is the treatment? Surgery is the treatment. In toto, we remove the tumor completely. Chemoradiation is done to reduce the size of the tumor. Always remember, but the treatment of choice is always surgery. So option B will be the best option. Coming to the next one, question number 10. Which of the following describe Trotter's triad? Now, what is Trotter's triad? Nasopharyngeal carcinoma. ET tube is blocked. When ET tube is blocked, patient is having conductive deafness, not sensory neural. Option B ruled out. Now, option D, read the option D. Ear discharge. Ear discharge? No. Retroorbital pain, diplopia. So this is something, a combination. Anyone who can tell me what is this combination? You should think in your mind. It is Gred-Nigo triad. It is not Trotter's triad. It is Gred-Nigo triad. It is in Peter's bone involvement. So this option is for Peter's bone involvement. Now option is A or C. Retroorbital pain is more going in the favor of Peter's bone involvement. It is palatal palsy because 10th nerve is involved. Pain because your 5th nerve is involved. Conductive deafness because of your serous otitis media glue ear. So this patient is having nasopharyngeal carcinoma, glue ear with 5th and 10th nerve palsy. 5th and 6th nerve palsy is Gred-Nigo triad. 5th and 10th, T for Trotter's, T for 10. Just remember in this way. So option A will be the best choice. I hope these questions are very easy. In the last spell, beta, take my honest advice. Don't do difficult questions. Just boost up your confidence. Do doable MCQs. Last PYQs very important. Question number 11. A child with throat pain found to have a white membrane over the tonsil which bleed. What is the hallmark feature? This patient have a membrane which bleed on scrubbing. What is the possible diagnosis? Diphtheria. What we have learned, streptococci never bleed. Diphtheria always bleed. One more important concept. Remember, if it is streptococcus membrane, it will be only on tonsil. It will never bleed. But if it is diphtherial membrane, always remember it is on the tonsil plus it is extending up to the palate, very important concept, and it always bleed. This will help in the examination. Let us revise again, beta. Streptococcal membrane never bleed. It is only confined to your tonsil, but diphtherial membrane, it is extending from the tonsil to the palate as well as it bleed on removal. It bleed on removal. Question number 12, next MCQ. Boy fell down while playing, noise is deviated, septum is normal. What is the treatment? Now you people tell me. Open reduction? Not at all. Or open reduction will not be done. Patient is having a history of trauma, nose deviated, some trauma. We should reduce as soon as possible. Am I understandable? Now, if there is a edema, I will give inflammatory and reduce after 7 days if edema subside. This should be the best option. Am I understandable? Clear? So we will give and reduce after 7 days. Close reduction, swelling automatically decrease, not at all. If there is a swelling, if there is a edema, we have to first subside the edema with giving anti-inflammatory. Close reduction is always done initially. Open is always after 3 weeks. Open is always 3 weeks. Trauma, septorhinoplasty will be not the option. So option C ruled out. Option A is the best choice. Question number 13. Smart student, after reading the word peanut, he will not waste the time in reading the rest part of the MCQ. Peanut butter like mucus. Examiner have given some CT finding. No other diagnosis except allergic fungal rhinosinusitis. What I'm seeing in this slide, focus your eyes on the board. What we are observing in this slide. In this slide, there is double density. Can you see these white lines? What are these white lines? These white lines are fungal elements. These are fungal elements. So in sinusitis, it is homogeneous. It is single density. But in case of allergic fungal rhinosinusitis, it is double density. So can I make a formula for it? Peanut butter like mucus with double density, heterogeneous double density is equal to allergic fungal rhinosinusitis. One important point. All these students are listening to me. One more important concept you should learn. In allergic fungal sinusitis, fungal culture is a minor criteria. Fungal culture is a minor criteria. This question can be there in your examination. Which of the following is minor? Fungal culture is a minor criteria. Treatment of choice of allergic fungal rhinosinusitis, FESS, functional endoscopic sinus search. Functional endoscopic sinus search. I tried my best to give you all the must-read topics better. In the last spell, it is your confidence which will decide your rank better. So doable MCQs, just do doable MCQs, boost up your confidence, and we are confident you all will be coming with the flying colors. Best wishes.